Hello, everyone. My name is Dr. Narjus Duma. I'm the leader and the founder of the Duma Lab, a laboratory that focuses on lung cancer as well as social justice, gender bias, and discrimination in medical education. Today, we're just going to have a little run through from the data that the Duma Lab is presented at 2021 ASCO annual meeting. Before we move a little bit ahead with the data, I want to share the story behind the Duma Lab. The Duma Lab was founded in 2019, initially called the Social Justice League, and now known as the Duma Lab. It's a laboratory focused on social justice and lung cancer. It has over 29 members in different institutions across the country and the globe. Is known to be highly diverse, with 70% of the members to come from underrepresented groups in medicine. Many of them are currently in training or are completing training. And the Duma Lab continues to thrive in a very unique model in which our goal is to amplify and support the next generation of oncologists and cancer health disparities. So let's talk about some of the data that the Duma Lab is presented at 2021 ASCO annual meeting. First, this abstract is by Dr. Patel and Dr. Riano. Evaluates the race and ethnicity and gender representation in oncology journals editorial boards. So the authors review the top journals for hematology, oncology, radiation oncology, and surgical oncology all around the globe. And they found that, unfortunately, 71.1% of editorial board members were not Hispanic white, and they were not represented the population. In addition, something that was very striking to me is that 72.6% of editorial board members were men, understanding that since 2017 in the United States, women have the majority of matriculants in medical schools. So the study shows that we continue to have lack of representation in gender, racial, and ethnic minorities in the journal's editorial boards. So this includes editor-in-chief, associate editors. So the problem with this is that having editorial boards that lack diversity leads to a loss of different perspectives. So we are seeing that the perspective, or we're seeing the reviewers of a very small group, which in this case is non-Hispanic white men. And it's important for academic medicine that we diversify these editorial boards in order to improve discovery, healthcare, and ultimately cancer care. So this abstract is by Dr. Riano and Dr. Patel. Following, we have a poster that will be presented by Dr. Balashakse from Henry Ford. She conducted a study in which she interviewed hematology oncology fellows about the perceptions of gender bias. This included adult and pediatric hematology and oncology fellows. 133 completed the survey, with a majority of females. These were self-identified females, around 66%, and the age was between 31 to 40%. The majority were self-identified as white. We have around 30% as Asian, 9% Hispanics or Latinas, and the rest were Black or Middle Easterns. So what the survey show is that women significantly, so 94.3% are mistaken as a non-physician compared to men, 22.2%. 76.1% of women feel insecure about their position compared to 35% of men. 67% experience bias associated with their gender compared to 11.1% of men. And something that I have experienced personally is being second guessed by staff, in which you make a medical decision, but they second guess your decision. And this was a significant difference in which female fellows felt like they were second guessed 64.8% compared to 28.9% of men. How did trainees navigate all this gender bias? Well, a large proportion of female fellows were wearing a white coat to help with this. They also wear a badge that says doctor and professional clothing. And the percentage cannot even be compared. We're talking about 64.8% versus 4.4%. So our hematology and oncology fellows face gender bias every day. This is self-reported by the fellows themselves, and we need to improve this current situation. Now we move to another poster from the DUMA lab. This is led by Dr. Blitzer, Dr. Merfa from the University of Wisconsin. And they are presented the data from the OCEAN study, which is short for Women's Career Choices about Oncology. This study is a cross-sectional survey that evaluates motivations to pursue or not pursue academic oncology for women. The investigators were able to interview 667 oncologists, of which 422 were from academic oncology and 241 were non-academic oncology. What they found is that many of the academic oncology women felt like being in academic oncology was a significant sacrifice of time with loved ones. And also, there was a significant sacrifice about the monetary or the revenue of being in academia versus no academia. But a very important observation is that we did not see any difference between the timing of childbearing between women in academic oncology and no academic oncology. Finally, many women in academic oncology felt that did not belong in medicine, so a poor sense of belonging. And 1 out of 5 women in academic oncology are considered leaving academia. And this is quite sobering to us because academic oncology remains a high risk for continued gender inequalities. And if 20% of these women are considered leaving, the exodus of women from academic oncology is not stopping unless we do something. Now we're going to move to another poster that's going to be discussed. This is for Dr. Jones and Dr. Dunn, and evaluates gender and racial ethnic disparities in academic oncology leadership. So the authors review the training programs for hematology oncology and radiation oncology for all the U.S. ACGME accredited programs. They look at trainees, academic faculty, program directors, and department chairs. A total of 7,722 individuals were reviewed individually to collect this data, with over 1,700 trainees and over 5,000 faculty. So what the authors found is that there's still a significant lack of representation. So on your left, you can see academic hematology oncology. And I want to call your attention to African-American females. So the green, the darker green, is department chairs. We have 1.3%, or over 7,000 people that are African-Americans in leadership positions. Then the authors put together the other groups as underrepresented groups in medicine, and they were put together because the numbers were so slow that the comparisons were not possible. And we continue to see very low representation on underrepresented groups in medicine and leadership, program directorships, and department chairs. But we see an increase in the number of fellows for these groups. So what these points is the lack of role models that many of these trainees may experience. And another poster discussion that we have for the DUMA lab, this is by Dr. Mañana Velázquez, evaluates the digital footprint of hematology oncology fellowships. Due to COVID-19, all hematology and oncology fellowship interviews in the United States took place online in 2020 for the match. So this meant that the programs needed to find a way to sell or help the trainees understand how their program work. So this study evaluated all the accredited programs and found that 67% of them reported the current fellows, 31% the alumni, 42% were trying to sell the city, and 35% resources of daily living. But what we saw is a significant increase in 2020 of YouTube and Twitter posts from these programs as they needed to reach the applicants in a different way. Unfortunately, all the videos that were portrayed in YouTube to promote the programs did not include significant number of underrepresented groups of medicine. So we're trying to reach candidates, but we continue to have unconscious bias and only portrayed majority white trainees or faculty when we're trying to recruit. So 80% diversity in the videos were white, 70% Asian. There was Asian in the videos, Asian trainees or Asian faculty. 28% of the videos have some Black faculty fellow or person in the video, and only 10% were Latinx. So despite the increase in the social media posts and different ways to reach our trainees, we're still lacking representation of people that looks and sounds like me and many members of the Duma Lab. Now we're going to move to the last poster, and this is from the OLA COVID study. The study was led by the Duma Lab and is the largest study that evaluates the effect of COVID-19 in cancer care in Latin America. This particular poster discussion focuses on the impact of COVID-19 and work-related fatigue and satisfaction among oncology providers in Latin America. We observed significant gender differences. 86% of the female felt exhausted by their work compared to 68% of men. 72% of female oncologists or oncology providers report work-related fatigue compared to 56%. And 61% reported that their fatigue significantly increased compared to pre-COVID. And I think this is very important to mention is that due to COVID and homeschooling, the responsibilities for women due to the social standards and stereotypes significantly increased with childcare. And finally, the team concludes that medical doctors who care for patients with COVID and have patients who experience cancer care delays due to COVID-19 have significantly fatigue and exhaustion. All of this is expected to increase the rates of burnout in the oncology providers in Latin America that already work in a limited resource environment. Finally, I want to thank all of you for listening to the data that is presented by many members of the Duma Lab. None of this work had been possible without the hard work of many women and men that are part of our research group. We focus on social justice, gender bias, racial discrimination, and lung cancer. Thank you.